Hey guys, Coach Carlo here from CrossFit Furion, and I want to talk to you today about low back pain and hip flexor tightness and the relationship between both of those. I have a degree in exercise phys. One of the people that I like to follow and study is Dr. Kelly Starrett. He's a doctor of physical therapy. He also owns a CrossFit gym on the West Coast. If you're in the CrossFit community, you've probably heard of him. He's written 3 books on body position, skeletal position, however you want to call it, and pain and dysfunction, movement dysfunction. And his premise and his belief, which I share, is that a lot of the issues that we deal with today as people with pain and lack of range of motion and the loss of a functionality to be able to do stuff is due to bad positioning. So one way you can think about that is if you wear a shoe that doesn't fit you and you wear it for an hour, you may get tenderness, you may get redness on your foot. If you wear it for 10 hours, you're probably going to get a blister. How does that tie into you guys and low back pain? Well, low back pain isn't necessarily about age. A lot of you guys go, I'm getting older, I got low back pain. It's more about length of time in a bad position. So just like length of time in that shoe matters to whether or not you're going to get a blister, length of time in a bad position, the older you are, the longer you probably have spent in that bad position. And then you're going to get a breakdown. The blister is the breakdown with the shoe. You getting low back pain can possibly be the breakdown with bad position. So bad position as it relates to what I'm going to talk about today, because there's a ton of stuff and I could go on forever and you're going to get bored and turn it off, and then you're going to miss all the stretches and stuff I'm going to do at the end. But bad position for our focus today is really about pelvic tilt forward. Okay, and that can be due to whether you have weak posterior chain or butt and hamstring activation, meaning you don't really use it, and so you don't use it, and that means your lower back has to kick in and hold yourself up, and so you're going to get tightness in your lower back. Or if you think about your pelvis as a bowl and the top of the bowl is tilted forward, so if the top of the bowl is tilted forward, then these muscles in the front are either going to get short because they're tilted forward, or they're the reason why you're tilted forward. Either way, you're going to get this bad position. Now, as that relates to one of the larger hip flexors that you have in the body, which is called the psoas, is that your psoas is a muscle that it goes from your spine, so basically right underneath your diaphragm, and it runs all the way down to the inside of your femur. Okay, it covers a lot of area, and because it's attached directly to your spine, it's going to yank on your spine. So what you get, what Dr. Starrett likes to call, is the man belly. So I have a lot of people in here that don't have range of motion in their pelvis because they have tight hamstrings. So because they have their tight hamstrings, they can't get their pelvis to go where it's supposed to go. So what they do to gain range of motion is they push their spine out to get themselves into a better position. Well, it's not really a better position. It's just getting themselves closer to what they think they need to be to do whatever movement it is they're doing. Now, because we're in a society that sits almost all the time, you sit when you drive, you sit when you eat, you sit when you're on the computer, you sit when you watch TV. So you're seated all the time. You may not even realize that you're doing it. You may adjust position here or there, but you may not realize that you're putting yourself in a bad spot. Even the people that work out, if you do the elliptical, if you ride a stationary bike or you ride a road bike, and even my weightlifters, myself included, when we're trying to get into a proper position, we may lose tension in our core, and we may allow our pelvis to tilt to gain some extra range of motion. So if I want to get myself down a little bit lower in my squat, I might press my spine forward, okay, to achieve that position. But what I'm really doing is I'm sacrificing spinal health. So that being said, the psoas is important in that because it attaches to your spine. If you get shortness or tension in your hip flexors, and your psoas being one of those hip flexors, it's going to tug on your spine, which can inhibit or cause breathing issues and can cause low back pain, right? So we're going to go over some things to help you with hip flexor tightness, and in particular the psoas, because a lot of people do stretches and they stretch out their quads, and then they will get their hip flexors, but they may not be getting deep enough in really attacking the psoas, which can be an issue. So I'm going to move over to here, and I'm going to show you a couple of exercises that are going to activate your hamstrings and your glutes, so your posterior chain as it's called, and also get your hip flexors and your psoas in particular to release. Okay, so again, the hip flexors being tight or short will pull the pelvis forward. What we want to do is get the pelvis straight again. So that requires us to be straight in our spine and straight in our hips. And when I say straight in the spine, I don't mean the spine's going to be in a straight line. It should have a natural curve. But what I mean is not overextended. So the first one that we're going to do is, and if you do yoga, you might have seen this before. The first one we're going to do is going to be an activation and a release of the psoas. So what I want you to press your lower back onto the floor. Your feet are going to be flat. You're going to press your lower back onto the floor. This is the end position that we're going to. You can rest your head down on the floor, and pressing your lower back into the floor is essentially making your pelvis go straight horizontally. Now what I want you to do is I want you to do the opposite. I want you to pick your lower back up off the floor, or tilt your pelvis forward, however you want to think about it. So you're going to tilt it forward, and then you're going to activate your hip flexors by pulling this leg up. Okay. While both of them are up, you're going to reverse it, and I'm going to press my lower back to the floor at the same time I'm straightening out my leg. This is going to lengthen those hip flexors and activate my posterior chain at the same time. What I'm going to do is stay there for a second, and then I'm going to tilt my pelvis forward, or lift my lower back off the floor, and then press it back down on the floor and bring my leg back up. Put my foot on the ground, and I'm going to do it all over again. So I'm going to tilt my hip or lift my back, activate my hip flexors, and then I'm going to push my leg straight and press my lower back onto the ground at the same exact time. If you're tight in the front, you might feel that stretch and release there. From there, I tilt the hip, press my lower back down again, and then bring my foot back up. Now you want to do this at least 5 or 10 times on each leg. Remember, you have one on each side, so you got to do both legs. The next one we're going to do is a bridge, but we're going to use these. If you don't have yoga blocks, you can use pillows. And I'm going to stick them in between my feet. If you can see, I'm going to stick them in between my feet, and I'm going to stick them in between my knees. All right, and I'm going to get my feet close to my butt. The blocks help keep my legs in alignment, so my feet and my knees are in alignment, and also keeping the block in between my knees helps me keep from externally rotating my legs. Okay, what I'm going to do now is I'm going to press my lower back into the floor, straightening out my pelvis, and now I'm going to drive my feet into the ground, and as I drive my feet into the ground, I'm squeezing my butt and I'm squeezing my core. What I don't want to do is, again, arch my back and stick my spine in front of me, because right now I can feel that making my lower back cramp up. I want to squeeze my stomach, squeeze my butt, squeeze my knees. All right, bring everything back down again, and then I'm going to go back up, and again, keeping everything nice and tight, driving my feet into the floor, stomach and butt stays nice and tight, keeping my knees together. Right, and as you do these, you may find that you can get a little bit higher every time you go. So we're going to move on. So after you've done them, and I would say for those bridges, 20, 30 reps of that, taking your time. The next one we're going to do is let me get my ball here. The next one we're going to do is a stretch for the psoas. And like I said, the psoas sits, let's put this right here. I know you guys are probably getting sick moving all over the place, but like I said before, the psoas attaches on the spine, so it's behind all of your organs, so it's very deep in your body, and it makes it hard to get to. But what it does is it comes forward as it moves down towards your leg, because it bowstrings over the front of the pubic bone. So what we're going to try and do is use that to our advantage and apply pressure down into our abdominal cavity and try and get a hold of that and stretch it out by pulling it even further over the pubic bone. Now, one of the things, so what I'm doing, so you can see, is I'm going to take this ball and I'm going to basically lay on it, and it's soft. You can use a partially deflated volleyball or soccer ball or something like that, but you want it to be soft. If it's too hard, you're not really going to get the effect that you want to get, which is you want it to spread a little bit so that you can press it in there. Plus, it'll probably hurt a little more than it needs to. So if I'm going to work on the right side, I'm going to bend my right knee, all right, and I'm going to put this right up into the cavity, the abdominal cavity, and you'll find it. So if you go too far to the side, it won't really hurt, okay? If you go all the way to the, as you pass, you'll feel a band, like probably about this wide, and you'll feel that tension, it'll hurt. If you go past it, you won't feel it anymore. So that's the band that we're looking for. It's off to the right and the left of the belly button. So if we're gonna work on the right side, I'm gonna bend my left knee, I'm gonna pull it up, and I'm gonna sit it and relax. I'm gonna relax on it. So that involves me releasing air, all right, and I make the stink eye face. And I wanna work it so that it gets up underneath my ribs, and I'm gonna slowly work it down and hang out in each spot and work it all the way down. And the beauty of the ball is you can work it all the way down into your pelvis, and you can get a hold of that psoas all the way down in the bottom. But again, the ball's you're gonna start it here, and you can work it down into the pelvis here, and really work it up. I'm gonna try and get it underneath the rib cage as much as you can. Relax, breathe out, exhale, and let yourself sink around that ball. That's when you're gonna get the most effect. The last one I'm gonna show you, and I'm gonna move this one more time, I promise. No more getting seasick. All right, and we're gonna put this over here. Hopefully we can see everything. And there we go. And this last one, I'm gonna show you the way I do it, and then I'm going to show you a way you could do it if you don't have quite the same mobility. So you're going to, if you have a resistance band and something to attach it to, right, you're going to step in it, wrap it up around the top of your femur, and you're going to get some tension in that band, put your knee down on the floor. All right, you're going to brace yourself on your front leg. Now remember what I said before, guys, we don't want our spine going forward because the psoas is attached to the spine. So that's one of the problems the reasons why we have that back pain is because we're allowing that psoas to pull the spine forward. So you need to squeeze your butt, straighten that pelvis out, keep it tight. This is super important that butt stays tight. Otherwise, you're not really going to get the effect that you want. Keep your core down. You don't press your ribs forward when we do this. So when I say you're going to press yourself forward, what we're doing is we're leaving our knee down and we're bringing our entire hip forward, not tilting our hip forward. There's a difference between pressing my hip forward this way and tilting my hip forward. I don't want to tilt my hip. So I'm going to keep that tension here. I'm going to press, keeping my core and my butt tight, and I can feel it now in my hip flexor. In the hip flexors directly in the front, and I'm going to press myself into that, staying nice and tight. Now if I want to attack the psoas a little bit more, I'm going to grab this foot, I'm going to pull it up. This is where some of the mobility comes into play. I'm going to grab this foot and pull it up nice and high, and then I take this hand and I'm going to grab my leg, and what I'm going to do is I'm going to turn my body, keeping my butt tight, and continue to press, pull this foot, and press, and turn, and hang out here. And that's going to help get that psoas, because as I turn away, I'm going to be opening up that psoas a little bit. Now, if you don't have the mobility for that, to be able to grab your foot, hold on, you can take whatever you can to stack up, and you can put your leg in there. And now what you're going to do is you're going to put your knee down and put your foot up on something to hold your leg elevated, and then you're going to do the same thing. Tighten this up, press yourself into it, and then rotate your body and get those hip flexors. All right? When you're doing these stretches, guys, when you're doing these positions, you want to hold at least a minute in each position. It sounds like a long time, but you need that much time to get the structural response that you're looking for. If you don't hang out for that long, basically the muscles reflex to tighten up will inhibit the effect that you're looking for. So I hope this helps you guys out. I know this video is a little bit long. Cool thing about the video is that as you go through these exercises, if you forget how to do something, you can always rewind it and watch it over again. If you have any questions or you have any comments, please put them below, and be on the lookout for my next video. I think I'm going to go back to some nutrition stuff, and I think I'm going to talk about insulin and how that affects weight gain. So take care, guys. Let me know if this helps. Let's talk to you soon.